Hello, welcome to Indications of Drug and Alcohol Abuse in the Workplace. My name is Chris Champion and I will be the instructor for this video presentation. The purpose of this video is to familiarize supervisors with the physical, behavioral, speech, and performance indicators for the use of the 5 drugs tested under DOT drug tests. These are marijuana, cocaine, opioids such as heroin, morphine, and hydrocodone, PCP, and methamphetamines. I'll also be reviewing the signs of alcohol abuse and intoxication in the workplace. The reason behind this is so that supervisors have the knowledge necessary to identify workers who are abusing drugs and are able to call for a reasonable suspicion drug test. By identifying workers who are under the influence of drugs and alcohol in the workplace and removing them from safety-sensitive roles, supervisors will be able to make a safer workplace. By the end of this video, you should be able to recall the indications of use for the 5 drugs tested under DOT drug tests and alcohol. Alright, this slide covers the indications of use for marijuana. Marijuana users often display red bloodshot eyes, they're more social and talkative, display increased appetite, and often show malaise or lethargy. Next, we have cocaine use indicators. Physical indications for cocaine use include dilated pupils and nosebleeds. Often cocaine users demand increased privacy and show signs of social isolation. They're often talkative and display increased risk-taking behaviors. This slide covers indications for opiate use. There are a great deal of them. Opiates include not just heroin, but prescription drugs such as hydrocodone, oxycontin, and fentanyl. Opiate users will display constricted pupils when high and can show signs of sleepiness or numbness. They will often be constipated. Behaviorally, they can be anxious, depressed, or confused. They can exhibit poor judgment. Their speech can be slurred at times. Performance-wise, they can display lack of motivation or memory problems. Next up, we have PCP use indicators. PCP users often experience hallucinations or delusions and can display a reduced sensitivity to pain. Often they will display aggressive and irrational behavior, coupled with a sense of superstrength and invulnerability. Speech can be sparse or purposeless while high. Performance indicators include poor coordination and dull impulses. Here we have methamphetamine use indicators. Physical signs for meth use include faster breathing, decreased appetite, weight loss, and tooth decay. Behavioral indicators include increased activity and wakefulness, anxiety, confusion, violent behavior, and paranoia. Finally, we have indicators for alcohol abuse. Signs of alcohol abuse are primarily absenteeism and missing deadlines. The main physical indicators are the smell of alcohol, slurred speech, and staggering, but sudden changes in personal appearance can also be a sign. Be on the lookout for mood swings and changes in attitude. Hopefully, today you have learned how to identify the use of alcohol in the 5 drugs tested in DOT drug tests. If you have an employee that you suspect of drug or alcohol abuse, and they show indications that you have learned here, you should call for a reasonable suspicion drug test. Thanks for watching, and be safe.